Stop talking and get that cleaning lady out of my operating room before she kills someone." The words cracked through the bright surgical theater like a slap against metal. Every nurse froze. The steady rhythm of the heart monitor filled the room with sharp electronic beeps while cold white surgical lights poured down over the table. Dr. Lucas Bennett stood over the patient with gloved hands stained dark red, his jaw tight with irritation. The woman near the doorway had spoken only a moment earlier, her voice calm and steady despite the tension in the air. She had pointed quietly toward the surgical field and said that his incision angle was wrong. No one in the room knew her name. To them, she was just the quiet cleaning lady who worked the night shift, pushing a gray cart through the hallways long after most surgeons had gone home. Yet she had stepped closer to the doorway and spoken again in that same calm voice, warning that the artery beneath his instrument was thinner than it looked on the monitor. Lucas barely glanced at her. In his mind, the situation was simple. He was the lead surgeon, one of the youngest doctors in the hospital to earn that title, and the operating room was not a place for janitors to give instructions. The patient on the table was a middle-aged man who had arrived only minutes earlier with severe internal bleeding after a highway collision outside the city. Every second mattered. Lucas tightened his grip on the surgical instrument and motioned impatiently toward the door. A nurse hesitated, glancing at the woman with the cleaning cart, but Lucas spoke again with sharper authority. "This is a sterile environment. Remove her immediately." The woman did not argue. She simply looked toward the surgical monitor one more time, her eyes quiet and strangely focused, as if she were studying something far deeper than the glowing numbers on the screen. The heart monitor continued its steady rhythm while the room filled with the faint smell of antiseptic and war metal. Lucas turned back to the patient, convinced that the interruption was nothing more than an annoyance from someone who did not understand medicine. He did not notice the slight crease of concern in the eyes of one older nurse who had heard the woman speak. He did not notice the way the woman paused before pushing her cart away from the doorway. Before continuing, comment where in the world you are watching from and make sure to subscribe because the story tomorrow is one you cannot miss. Now back inside the operating room, the tension had thickened. Lucas leaned closer over the surgical field while the bright light reflected off the steel instruments like small flashes of lightning. He could feel the weight of the moment pressing down on the entire team. A man was fighting for his life on that table, and Lucas was determined to prove that his reputation as the most promising young surgeon in the hospital was deserved. What he did not realize was that the quiet woman he had just ordered out of the room had been watching every movement of his hands with the careful attention of someone who had once spent an entire lifetime inside operating rooms just like this one. The operating room doors swung closed behind the quiet woman, and the faint rattle of her cleaning cart faded down the hallway, leaving only the steady electronic rhythm of the heart monitor and the low hum of surgical lights above the table. Dr. Lucas Bennett leaned closer over the patient, forcing the interruption from his mind. His gloved hands moved with practiced speed, steel instruments glinting beneath the white light. The patient lay motionless beneath the drapes, chest rising slightly with the help of the ventilator, while the anesthesiologist watched the monitors with careful focus. Lucas could still hear the echo of the woman's warning in the back of his mind, but he pushed it away. In his world, operating rooms belonged to surgeons, not cleaning staff who wandered too close to doors they did not understand. He adjusted the angle of his instrument and spoke quietly to the surgical nurse beside him. "Suction." The nurse passed the tool into his hand without hesitation. Dark blood pooled briefly around the incision before the suction cleared the field again. Lucas studied the exposed tissue with narrowed eyes. The bleeding source was deeper than expected, hidden beneath layers of muscle and delicate vessels that pulsed with each heartbeat. Every second mattered. The trauma team had already lost precious time bringing the patient from the ambulance bay to the operating room. Outside the hospital, sirens had screamed across the night as emergency crews fought to stabilize the man. After the violent highway collision that had crushed the front of his truck against a concrete barrier nearly 20 miles outside the city. Lucas had been called from the surgical lounge only minutes earlier, barely finishing his coffee before rushing into the bright intensity of the operating room. Now all attention centered on the narrow surgical field beneath his hands. He carefully shifted the clamp and began extending the incision, determined to locate the source of the internal bleeding before the patient's blood pressure dropped further. The heart monitor continued its steady rhythm, each electronic tone echoing against the sterile walls of the room. For a moment, everything felt controlled again, predictable, exactly as surgery should be. Yet the older circulating nurse, standing near the instrument table, glanced briefly toward the closed door, her expression thoughtful. She had heard the cleaning woman speak, and the calm certainty in that voice had unsettled her in a way she could not quite explain. Lucas, however, noticed none of it. His focus remained fixed on the surgical field as he worked deeper into the wound. The suction device hummed softly while the nurse wiped away thin lines of blood from the edges of the incision. Beneath the bright lights, the exposed vessels looked almost silver against the dark red tissue. Lucas carefully lifted a small artery with the tip of the instrument, studying its path along the patient's kidney. Something about the anatomy seemed slightly different from what he had expected. The vessel curved at a sharper angle than usual, disappearing behind a narrow fold of tissue that partially hid its connection to a larger branch. Lucas paused for a brief moment, considering the best way to proceed. Behind the surgical mask, the team waited silently for his decision. Then Lucas continued, adjusting his instrument and moving the clamp slightly deeper. The metal touched the vessel, and he prepared to seal the bleeding point with one precise movement. In the quiet of the room, the heart monitor sounded a steady electronic pulse. The surgical lights reflected from the instruments like pale stars above the table, while Lucas positioned the clamp with confident precision, unaware that the next decision he made would bring the operation dangerously close to the exact mistake the quiet woman had warned him about only minutes earlier. Dr. Lucas Bennett lowered the clamp slowly toward the thin artery he had. Lifted with the tip of the instrument, his eyes focused through the magnifying lenses of his surgical glasses while the bright operating lights illuminated every tiny detail of the exposed tissue. The room had fallen completely silent except for the steady mechanical breathing of the ventilator and the rhythmic electronic pulse of the heart monitor. Around him, the surgical team stood ready, each person watching the movement of his hands with the quiet concentration that comes from years of experience inside operating rooms. Lucas felt the familiar pressure that always came with trauma surgery. Lives were measured in seconds here, and hesitation could cost everything. He adjusted his grip on the instrument and carefully positioned the clamp along the curved vessel that ran beside the patient's kidney. From this angle, it looked like the source of the bleeding. The anatomy seemed unusual but not impossible. Trauma could distort the normal structure of the body in unpredictable ways. Lucas reminded himself of that as he leaned slightly closer over the surgical field. "Seal it," he said calmly. The nurse beside him prepared the next instrument while the suction device hummed softly to keep the area clear. For a brief moment, Lucas hesitated. Somewhere in the back of his mind, he remembered the quiet voice from the doorway earlier, the cleaning woman warning him that the artery beneath his instrument was thinner than it appeared on the monitor. He dismissed the thought almost immediately. Cleaning staff did not understand vascular anatomy. This was his operating room, and he trusted his own judgment. Lucas tightened the clamp. The metal pressed against the vessel, and for a fraction of a second, everything seemed normal. Then the surgical field suddenly filled with a rush of dark blood. The suction device roared louder as the nurse quickly moved it into position, but the bleeding was far heavier than expected. The artery Lucas had clamped was not the source of the injury. It was feeding a larger vessel hidden beneath the fold of tissue he had noticed earlier. The pressure change had caused the deeper artery to rupture. The heart monitor began to change its rhythm, the steady electronic pulse growing faster and sharper. "Blood pressure is dropping," the anesthesiologist said from the head of the table, his voice calm but urgent. Lucas felt a tight knot form in his chest. "Clamp pressure," he said quickly, reaching for another instrument. The suction cleared the field again, but the deeper vessel continued to pulse with heavy bleeding. Lucas searched for the exact point of rupture, his eyes moving rapidly across the exposed anatomy. The older circulating nurse glanced briefly toward the closed operating room door again. The memory of the cleaning woman's warning had returned to her mind with unsettling clarity. Lucas worked faster now, adjusting the clamp and trying to control the bleeding while the team moved around him with practiced precision. The bright surgical lights reflected off the instruments and the stainless steel trays while the heart monitor continued its sharp electronic rhythm. Lucas lifted another section of tissue, finally revealing the damaged vessel beneath. It curved sharply along the kidney, exactly where the woman had warned him the artery would be thinner. Lucas froze for half a second as the realization flickered through his mind. She had seen it before he did. The thought vanished almost as quickly as it came. There was no time to think about that now. More suction, he ordered, his voice tighter than before. The nurse moved immediately while Lucas repositioned the clamp and prepared to repair the deeper vessel before the patient lost more blood. Outside the operating room, far down the quiet hospital hallway, the cleaning woman slowly pushed her cart along the polished floor, the faint squeak of its wheels echoing softly beneath the dim night lights while the life and death struggle she had tried to warn them about continued behind the closed doors. The suction device roared louder as the surgical nurse pressed it deeper into the wound, clearing the dark surge of blood that continued to pulse from the ruptured vessel. Dr. Lucas Bennett leaned forward under the harsh white surgical lights, his shoulders tense while he searched for the exact point where the artery had torn. The operating room had shifted from controlled urgency to something sharper, more fragile, like a tightrope stretched over open air. Blood pressure continues to fall, the anesthesiologist said quietly from the head of the table while watching the glowing monitors. The electronic tones had grown faster now, each sharp pulse echoing through the sterile room. Lucas steadied his breathing. Focus. He had repaired worse injuries before. Trauma surgery demanded speed, but also calm precision, and panic had no place inside an operating room. More suction, he said. Again. The nurse adjusted the instrument while Lucas carefully lifted the surrounding tissue with a narrow surgical retractor. Beneath the fold of muscle, the damaged artery finally came fully into view. It curved along the patient's kidney exactly where the anatomy had looked unusual earlier. The vessel wall was thinner than expected, and the tear had opened wider under the pressure of the patient's blood flow. Lucas felt a brief chill of recognition move through him. The quiet woman near the door had warned him about that exact detail only minutes earlier. For a moment, the memory of her calm voice returned to him as clearly as if she were standing beside the table again. Your incision angle is wrong. The artery is thinner than it appears. Lucas forced the thought away. This was not the time for second-guessing. Clamp, he said. The instrument was placed into his waiting hand. He positioned it carefully along the deeper artery this time, stabilizing the damaged section while the suction continued clearing the field. The bleeding slowed slightly, but had not stopped. Lucas studied the exposed vessel, calculating the fastest way to repair the tear before the patient lost more blood. Prepare a vascular stitch, he ordered. The surgical nurse opened the sterile package while the circulating nurse moved closer to the instrument table. Around them, the operating room lights reflected off the polished steel tools arranged in careful rows. Outside the large glass viewing window, the hospital hallway remained dim and quiet, the night shift moving slowly through the building while most of the city slept. Lucas placed the first stitch with steady hands, guiding the needle through the delicate wall of the artery. The vessel trembled slightly beneath the pressure of the instrument, but held long enough for him to tie the suture. The bleeding slowed again, blood pressure stabilizing slightly, the anesthesiologist reported after watching the monitor for several seconds. Lucas allowed himself a small breath of relief. Continue suction, he said. He placed another stitch along the damaged section, reinforcing the repair while the surgical team worked around him with quiet efficiency. Gradually, the dark pool of blood receded from the surgical field, and the exposed vessels began to regain their normal color beneath the bright lights. The heart monitor returned to a steadier rhythm. Lucas studied the repair carefully before removing the clamp from the artery. 4. A tense moment, everyone in the room watched the vessel. The blood flow resumed through the repaired section without bursting the stitches. The bleeding had stopped. The circulating nurse released a quiet breath while the anesthesiologist nodded slightly toward the monitor. Blood pressure is recovering. Lucas leaned back a few inches from the table, the tension easing slightly from his shoulders. The patient was not safe yet, but the immediate crisis had passed. As the surgical team prepared to continue repairing the internal damage caused by the crash, Lucas glanced once toward the closed operating room door. The hallway beyond it was silent now. Somewhere out there, the quiet woman with the cleaning cart had already disappeared deeper into the hospital, leaving behind the warning he had dismissed and the mistake that had nearly cost a man his life. The repaired artery held steady beneath the surgical lights while the operating room slowly returned to a controlled rhythm. Dr. Lucas Bennett studied the delicate line of sutures one more time before nodding slightly to himself. The bleeding had stopped, and the patient's blood pressure had begun to climb back toward a safer level. Around the table, the surgical team moved with quieter confidence now, their movements precise and practiced after the tense minutes that had nearly turned the operation into a disaster. Lucas wiped a small line of moisture from his forehead with the edge of his sleeve before leaning back over the surgical field. "We continue," he said calmly. The trauma had caused damage deeper in the abdomen, and the internal bleeding had to be fully controlled before the patient could leave the operating room. The surgical nurse handed him another instrument while the suction device hummed softly again, clearing small traces of blood from the incision. Beneath the bright white lights, the repaired vessel looked fragile but stable, the thin artery pulsing gently with each heartbeat as blood flowed through the new stitches. Blood pressure stabilizing further, the anesthesiologist reported quietly from the monitor station. Lucas gave a brief nod without looking away from the patient. "Good. Let's finish this." He carefully examined the surrounding tissue for any additional injuries from the collision. The impact from the crash had twisted the internal organs in a way that made the anatomy more difficult to read, but the immediate danger had passed. Lucas placed several additional sutures to reinforce the repair and gradually began closing the deeper layers of muscle. The tension that had filled the room earlier slowly faded as the operation moved toward completion. Yet the memory of the earlier mistake had not faded from Lucas's mind. As his hands continued their steady work, he replayed the moment again and again in silence. The warning, the calm voice, the way the woman had spoken with absolute certainty, even though she stood in the doorway, holding nothing more than a cleaning cart. Lucas had dismissed her instantly. In his mind, she had been invisible the moment he saw the gray uniform and the mop bucket beside her. Now, the realization pressed quietly at the edge of his thoughts. She had seen the problem before he did. Lucas pushed the thought aside and focused on finishing the final sutures. After several more careful minutes, he stepped back slightly from the operating table while the surgical nurse prepared the final closure materials. The patient's vital signs remained steady, and the monitors now showed a stable rhythm that echoed softly through the room. The most dangerous part of the night was over. Lucas removed his gloves and dropped them into the medical waste container while the team completed the last steps of the procedure. "Good work, everyone," he said with a calm tone that hid the tension still lingering in his chest. The anesthesiologist nodded once while continuing to monitor the patient. The circulating nurse began documenting the procedure at the station near the wall. For a brief moment, the operating room felt almost peaceful after the intensity of the previous half hour. Lucas walked toward the stainless steel sink near the door and began washing the remaining traces of blood from his hands beneath the warm stream of water. As he stood there, the older, circulating nurse glanced toward him before speaking quietly. "Dr. Bennett, that woman earlier." Lucas did not turn around immediately. "What about her?" The nurse hesitated for a moment, as if choosing her words carefully. She sounded like she knew exactly what she was talking about. Lucas stared down at the water flowing over his hands. The words settled heavily in the silence of the room. For the first time since the operation began, he allowed himself to think about the possibility that the woman with the cleaning cart might not have been what she seemed. Somewhere in the quiet hospital corridors outside the operating room, the cleaning cart continued to move slowly across the polished floor, its wheels echoing faintly through the dim night halls while Dr. Lucas Bennett stood at the sink, realizing that the stranger he had dismissed might have been the one person in the building who understood the operation better than anyone inside that room. Warm water continued flowing over Dr. Lucas Bennett's hands as he stood at the stainless steel sink just outside the operating room. The soft sound of running water filled the quiet space while the tension from the surgery slowly drained from his shoulders. Behind him, the surgical team was finishing the final steps of the procedure, their voices low and steady as they prepared the patient to be transferred to intensive care. The patient had survived the worst of the trauma, but the narrow margin between success and disaster still echoed in Lucas's mind. He reached for a clean towel and dried his hands slowly, staring at his reflection in the small mirror above the sink. The fluorescent hospital lights made his face look pale and tired, the way surgeons often looked after hours inside an operating room. Yet what troubled him now was not the exhaustion. It was the memory of the quiet woman standing near the doorway earlier, speaking with calm certainty while everyone else had dismissed her presence. "Your incision angle is wrong. The artery is thinner than it appears." Lucas had heard those words clearly. At the time, they had sounded like nothing more than interference from someone who did not belong in a sterile surgical environment. Now they replayed in his mind with uncomfortable clarity. Dr. Bennett, the circulating nurse, said from behind him, her voice gentle but thoughtful. Lucas turned slightly. "Yes." She hesitated for a moment before continuing. "I have worked in this hospital for nearly 20 years. I have heard surgeons speak with confidence. I have heard them guess. But that woman earlier did not sound like she was guessing." Lucas said nothing for several seconds. The hallway outside the operating room was quiet except for the distant hum of hospital machines and the faint squeak of a cart rolling across polished tile somewhere farther down the corridor. Finally, Lucas spoke. "Did anyone recognize her?" The nurse shook her head slowly. "I have seen her on the night cleaning crew before, but she usually keeps to herself." Lucas folded the towel neatly and placed it beside the sink. The question continued to grow heavier in his thoughts. How had she known exactly where the artery would tear? The older nurse watched him carefully. "You might want to speak with her," she said quietly. Lucas gave a small nod, but did not answer immediately. He stepped into the hallway and looked down the long corridor where the dim night lights cast pale reflections across the polished floor. The hospital at night always felt different from the busy daytime hours. The noise softened. Conversations grew quieter. Even the air seemed to move more slowly through the building. Somewhere out there, the cleaning crew continued their work, moving from one floor to the next with little attention from the doctors and nurses who passed them every day. Lucas began walking down the hallway, his steps echoing softly against the tile. As he moved deeper into the corridor, he noticed the faint scent of disinfectant and floor polish lingering in the air. The hospital maintenance carts often left that smell behind as they passed through each wing. Near the far end of the hall, he finally saw it. A gray cleaning cart stood beside the wall under a row of dim lights. A woman was slowly wiping the floor nearby with steady, unhurried movements. Her posture was calm, almost thoughtful, as if the quiet hallway around her was a place for reflection rather than labor. Lucas slowed his pace as he approached. For a moment, he simply watched her work. She moved with quiet confidence, the same steady calm that had been in her voice earlier inside the operating room. When she finished wiping a section of the floor, she straightened and placed the cloth back on the cart. Then she turned slightly and noticed Lucas standing several feet away. The two of them looked at each other across the silent corridor. Lucas opened his mouth to speak, but for the first time that night, he hesitated. Something about the woman's composed expression made him feel as though he were the one standing outside his proper place. Dr. Lucas Bennett stood still in the dim hallway, while the quiet woman looked at him from beside the gray cleaning cart. The fluorescent lights above them cast pale reflections across the polished floor, turning the long corridor into a tunnel of soft, white glow and shadows. For a moment, neither of them spoke. The hospital at night carried a strange kind of silence, broken only by distant machine hums and the occasional rolling sound of a cart far down another wing. Lucas finally cleared his throat. Earlier in the operating room, you said something about the artery near the kidney. The woman studied him calmly without any sign of surprise. Yes, she said in a quiet voice. Lucas took a step closer. You were correct. The vessel was thinner than it appeared on the imaging monitor. The repair was difficult because of it. The woman rested her hands lightly on the handle of the cart. I assumed it might be, she replied gently. Lucas frowned slightly. You assumed. She gave a small, thoughtful nod. That particular variation happens sometimes when the artery curves sharply before entering the renal branch. The way the trauma twisted the abdomen would make it even harder to see clearly from the angle you had. Lucas felt the air shift slightly in his chest. Her explanation sounded precise. Not like a guess. It sounded like the calm reasoning of someone who had spent years studying anatomy inside operating rooms. He folded his arms slowly. You seem very familiar with surgical procedures. The woman looked down briefly at the cloth resting on the cart before answering. Hospitals are full of lessons if you pay attention long enough. Lucas watched her carefully. Her tone remained gentle and calm. Yet something about the way she spoke carried a quiet authority that made him feel strangely uncertain. He realized he had never even asked her name. What is your name? Grace Walker, she said. Lucas nodded once. I am Dr. Lucas Bennett. She smiled faintly. I know. Lucas blinked in mild surprise. How would you know that? Grace gestured softly toward the operating room doors behind him. Your voice carries clearly when you are leading a trauma surgery. Lucas felt a faint warmth creep up his neck. The memory of his own sharp command earlier returned with uncomfortable clarity. Stop talking and get that cleaning lady out of my operating room. The words now sounded far less confident than they had inside the heat of the moment. He shifted slightly, unsure how to continue. You recognize the arterial structure very quickly, he said. After a pause, that is not something most people would notice. Grace leaned lightly against the cart while considering his question. Anatomy is like language, she replied. If you listen carefully enough, the body usually tells you where the problem is hiding. Lucas studied her face. There was no arrogance in her expression, only a quiet steadiness that made her seem older and more experienced than he had first assumed. He realized that she had not asked whether the patient survived. It was as if she already expected the answer. The patient is stable now, Lucas said slowly. Your observation may have prevented a much worse outcome. Grace gave a small nod, but did not appear surprised. That is good to hear. Lucas felt a growing curiosity replacing his earlier irritation. How long have you worked here? He asked. Several years, she replied, mostly during the night shift. Lucas glanced briefly at the cart beside her. It held cleaning cloths, disinfectant bottles, and a mop bucket filled with cloudy water. Yet the woman standing beside, it spoke about vascular anatomy with the quiet precision of a medical professional. The contrast made his mind struggle to reconcile the two images. He looked back at her. Before tonight, have you ever studied medicine? Grace Walker remained silent for a moment while the hallway lights reflected softly in her eyes. Then she answered in the same calm voice. Yes. Lucas felt his heartbeat shift slightly in his chest as he realized that the woman he had dismissed only minutes earlier might be far more than the cleaning worker he had assumed. The word yes lingered in the quiet hallway like a note that refused to fade. Dr. Lucas Bennett stood facing Grace Walker while the dim fluorescent lights hummed softly above them. For several seconds, he said nothing. In the distance, an elevator door opened and closed somewhere deep in the hospital, the faint echo traveling down the corridor before disappearing again into silence. Lucas studied the woman carefully. Her posture remained relaxed beside the cleaning cart, one hand resting lightly on its metal handle. There was nothing defensive in her expression, no attempt to impress him or justify what she had said earlier in the operating room. She simply watched him with calm patience, as if this conversation was unfolding exactly the way she expected. You studied medicine, Lucas repeated slowly. Grace. Not at once. A long time ago. Lucas glanced at the cart again and then back at her. That answer only deepened the mystery in his mind. Most people who studied medicine did not end up working night shifts pushing cleaning carts through hospital hallways. "What school did you attend?" he asked. Grace lifted a cloth from the cart and folded it neatly while she considered the question. "Johns Hopkins School of Medicine," she said quietly. Lucas felt his thoughts stumble for a moment. The name carried enormous weight in the medical world. Surgeons trained there were often among the best in the country. He tried to keep his expression neutral, but the surprise was difficult to hide. "That is one of the most competitive medical schools in the United States." Grace gave a small smile. "Yes, it is." Lucas took another step closer, the curiosity in his voice growing stronger. "Did you complete your residency?" "Yes," she said simply. "In vascular surgery." Lucas blinked slowly. The same field he had spent years studying himself. The same specialty that had nearly led him into a fatal mistake less than an hour earlier. The quiet hallway seemed to tighten around the conversation. "If you trained as a vascular surgeon," Lucas said carefully, "why are you working here as part of the cleaning staff?" Grace looked down the corridor for a moment, as if remembering something far away before answering. "Life sometimes changes directions in ways we do not expect." Lucas folded his arms again. That answer sounded gentle but incomplete. "You recognize the arterial variation immediately," he said. "That kind of knowledge usually comes from years inside operating rooms." Grace did not deny it. "I spent many years there," she said softly. Lucas felt a strange sense of tension growing in his chest. The more she spoke, the less her story matched the simple role he had assigned to her earlier in the night. The woman standing in front of him was not guessing about anatomy. She spoke about surgery with the quiet confidence of someone who had once lived inside that world every day. Lucas searched his memory. During his residency, he had studied surgical textbooks written by some of the most respected vascular specialists in the country. One name in particular had appeared again and again in the chapters discussing complex arterial reconstruction, a name that older surgeons often mentioned. With admiration, Grace watched him silently as his thoughts began to move faster. "You said you studied vascular surgery," Lucas continued slowly. "What did you practice after residency?" Grace rested both hands on the cart again. "Several hospitals over the years," she replied. "Mostly teaching hospitals." Lucas felt a subtle shift in the air around him. Teaching hospitals meant medical residents. Young doctors learning the discipline of surgery under experienced mentors. A faint memory flickered in the back of his mind. During his own training years, one of the senior attending surgeons had often spoken about a legendary vascular specialist who had trained generations of residents before suddenly disappearing from the academic world. The name had appeared in research journals, surgical textbooks, and lecture recordings used during advanced training. Lucas studied Grace Walker again, noticing for the first time the sharp intelligence behind her calm eyes. Something about her presence felt strangely familiar in a way he could not fully explain. And for the first time that night, a quiet question formed in his mind that he had not dared to ask yet. Who exactly had he just ordered out of his operating room? Dr. Lucas Bennett remained standing in the dim hallway while the question continued to grow inside his mind. The name Grace Walker echoed quietly in his thoughts. Somewhere deep in the memories of his residency training, that name felt familiar, like a word he had heard many times but never expected to encounter in person. The hospital corridor remained calm and nearly empty while the faint hum of ventilation drifted through the ceiling vents. Grace rested her hands gently on the handle of the cleaning cart, watching Lucas with a patient expression that made the silence feel less uncomfortable than it should have been. Lucas finally spoke again, his voice slower now. "You mentioned teaching hospitals. Were you involved in residency training?" Grace gave a small nod. "Yes, for many years." Lucas felt a subtle tightening in his chest. Teaching residents meant supervising young surgeons during the most difficult years of their training. The thought pushed another memory closer to the surface of his mind. During his own residency, the senior surgeons had often quoted one particular vascular specialist whose surgical techniques were studied across the country. Her methods for repairing complex arterial injuries were considered groundbreaking in trauma surgery. Lucas had memorized several of those. procedures while studying late at night during his training. He remembered the textbooks with careful diagrams explaining the exact arterial variations that could appear near the kidney during traumatic injury. Lucas slowly exhaled. Those techniques were written by a surgeon named Dr. Grace Walker. The woman standing beside the cleaning cart did not react immediately. Instead, she tilted her head slightly, as if acknowledging the memory without needing to confirm it. Lucas stared at her more carefully now. The calm eyes, the quiet confidence, the way she had recognized the arterial variation inside the operating room faster than anyone else. A strange realization began forming in his mind piece by piece. During residency, his attending surgeons had spoken about Dr. Grace Walker with almost legendary respect. They described her as one of the most brilliant vascular surgeons of her generation, a teacher whose residents went on to lead trauma programs across the country. Then suddenly, she had disappeared from the academic world without explanation nearly a decade earlier. Lucas remembered hearing those stories while standing beside operating tables just like the one he had worked on earlier tonight. His instructors had often said the same thing. If you ever have a chance to learn from Dr. Walker, listen carefully. She sees things most surgeons miss. Lucas looked down the hallway again, then back at the woman in front of him. The possibility now felt almost impossible and yet increasingly clear. Grace Walker watched his expression shift as the realization moved across his face. "You are remembering something," she said quietly. Lucas nodded slowly. "My residency program studied surgical reconstruction methods written by Dr. Grace Walker." Grace said nothing for several seconds. Lucas continued speaking, the pieces finally aligning in his mind. Those techniques explained the exact arterial variation that nearly caused the rupture tonight. The same variation you recognized immediately from the doorway. Grace Walker offered a faint smile that carried neither pride nor embarrassment. "Knowledge tends to remain useful even after many years away from an operating room," she said softly. Lucas felt the air leave his lungs as the truth settled fully into place. The woman he had dismissed as a cleaning worker was not simply someone who had studied medicine long ago. She was the surgeon whose research he had relied on during his own training. She was the teacher whose methods had guided him through some of the most complex cases he had ever performed. And only an hour earlier, he had ordered security to remove her from the operating room, as if she were nothing more than an inconvenience. Lucas lowered his eyes briefly, the weight of the realization settling heavily in his chest. For a long moment, the hallway remained silent, except for the faint rolling sound of the cleaning cart wheels as Grace slowly adjusted its position beside her. When Lucas finally looked up again, his voice had changed. "Dr. Walker," he said quietly, "I believe I owe you an apology." Dr. Grace Walker regarded Lucas Bennett quietly after he spoke the words. The apology hung in the air between them, fragile and sincere. For a moment, the hallway remained still except for the soft vibration of the overhead lights and the distant hum of hospital machinery somewhere far beyond the corridor. Lucas stood with his shoulders slightly lowered, the confidence that had filled his voice inside the operating room now replaced by something far more honest. "I was wrong earlier," he continued slowly. "I assumed you were someone who did not belong in that room. I did not listen when you tried to help." Grace rested her hands lightly on the handle of the cleaning cart and studied him with thoughtful calm. "Hospitals are full of assumptions," she said gently. Lucas gave a quiet breath that almost sounded like a laugh, though there was little humor in it. "I have spent years studying vascular surgery. Your textbooks were required reading during my residency. Yet tonight, I ignored the person who wrote them." Grace did not appear offended. Instead, she looked down the long hallway, as if considering the strange path that had brought both of them to this quiet moment. "It happens more often than you might think," she said softly. "Experience is easy to overlook when it arrives wearing ordinary clothes." Lucas nodded slowly. The weight of that truth settled deeply in his thoughts. He remembered the exact tone of his own voice when he had ordered her out of the operating room. At that moment, he had not even looked at her closely enough to notice the calm certainty in her expression. The operating room door opened quietly behind him as the circulating nurse stepped into the hallway. Dr. Bennett, the patient is being transferred to intensive care. Vital. Signs remain stable. Lucas turned his head slightly and nodded. Thank you. When the door closed again, he faced Grace once more. That patient survived because of the warning you gave me, he said. If I had continued with the first clamp placement, the rupture would have been far worse. Grace gave a small nod. You corrected the mistake quickly. That is what matters most in surgery. Lucas hesitated before speaking again. May I ask something? Of course. Why are you working here like this? Grace looked at the cleaning cart beside her before answering. Several years ago, my husband became ill. The treatments were long and expensive. I stepped away from surgery to care for him. When he passed away, I realized that returning to the academic world was no longer something I wanted. The hospital allowed me to work here during the night shift, so I could stay close to the place that had been my life for many years. Lucas listened quietly. The explanation was simple, but it carried a quiet dignity that made the hallway feel heavier with meaning. You still belong in the operating room, he said after a moment. Grace smiled gently. Perhaps, but sometimes it is enough simply to watch and help when the moment requires it. Lucas lowered his gaze briefly. I wish I had recognized you sooner. Grace shook her head slightly. Recognition is not the most important thing for a surgeon. Listening is. Lucas felt those words settle deeper than any criticism could have. In his training, he had learned anatomy, surgical technique, and the discipline required to perform under pressure. Yet the lesson standing in front of him now was about humility. Grace reached for the cloth resting on the cart and folded it neatly before placing it beside the disinfectant bottle. The night shift still has many floors to finish, she said calmly. Lucas stepped slightly to the side of the corridor to clear the path. As she began pushing the cart forward, the small wheels rolled softly across the polished floor. After a few steps, she paused and looked back at him. Dr. Bennett. Lucas straightened slightly. Yes. The patient tonight will recover well if the repair continues to hold. You handled the final sutures with care. Lucas nodded, grateful for the quiet encouragement. Thank you, Dr. Walker. Grace gave a small nod in return and continued. Down the hallway, the cart moving steadily beneath the dim lights. Lucas remained standing where he was long after she disappeared around the corner, realizing that the most important lesson he had learned that night had not come from a textbook or a surgical lecture, but from the quiet wisdom of the woman he had once mistaken for someone who did not belong. Dr. Lucas Bennett remained standing in the quiet hallway long after Grace Walker disappeared around the corner with the cleaning cart. The soft sound of the wheels faded slowly until the corridor returned to silence. Lucas finally exhaled and leaned lightly against the wall beside the operating room doors. The events of the night replayed in his mind with sharp clarity. The warning he had dismissed. The moment the artery ruptured beneath his clamp. The calm voice from the doorway that had seen the danger before anyone else in the room. He closed his eyes briefly and shook his head at the memory of his own arrogance. Inside the operating room, the surgical team finished transferring the patient to a mobile bed. A nurse stepped into the hallway again and noticed Lucas standing there. Dr. Bennett, the patient has been moved to intensive care. The vital signs remain strong. Lucas opened his eyes and nodded. Thank you. He followed the nurse down the corridor toward the intensive care unit, where the patient now rested behind glass walls surrounded by softly glowing monitors. Through the window, Lucas could see the steady rise and fall of the patient's chest beneath the blanket. The repaired artery was holding. The surgery had succeeded despite the mistake that had nearly destroyed everything. Lucas stood quietly for a moment before turning toward the nurse beside him. Do you know where Grace Walker usually works during the night shift? The nurse looked slightly surprised by the question, but answered quickly. She normally finishes the surgical wing and then cleans the lower floors near the teaching lecture halls. Lucas nodded slowly. Thank you. The nurse studied his face with curiosity, but said nothing further as she returned to her duties. Lucas began walking again through the quiet hospital corridors. The building felt different now. Earlier that night, he had moved through these halls with the certainty of someone who believed he understood every role within the hospital walls. Surgeons operated. Nurses assisted. Cleaning staff worked. quietly in the background, now that simple hierarchy no longer felt so clear. As Lucas approached the lower-level lecture halls, he noticed the familiar scent of disinfectant drifting through the air again. The hallway lights were dimmer here, leaving long shadows stretching across the polished floor. At the far end of the corridor, he saw Grace Walker once more. She was wiping the floor slowly near the entrance to one of the old teaching rooms where medical residents often gathered during the day to study surgical techniques. Lucas stopped several feet away and watched for a moment. The door behind her was slightly open, and through the narrow gap, he could see the rows of empty seats and the large projection screen where countless surgical lectures had been presented over the years. Grace finished wiping the floor and stood upright, stretching her back slightly before placing the cloth back on the cart. When she turned and saw Lucas again, she gave a small, knowing smile. "You're still awake, Dr. Bennett," she said gently. Lucas walked a few steps closer. "I wanted to thank you again, not only for the warning earlier, but for the lesson that came with it." Grace tilted her head slightly. "Lessons rarely appear in comfortable moments," she replied. Lucas glanced at the open lecture hall behind her. "During my residency, we studied many of your surgical demonstrations in rooms like this. I remember watching recordings of your trauma reconstruction procedures late at night while preparing for exams." Grace looked through the doorway for a moment, her eyes soft with memory. "Those lectures were a long time ago." Lucas nodded. "They're still teaching them today." A quiet silence settled between them again. Lucas finally spoke with a sincerity that carried more humility than anything he had said earlier that night. "I would be honored if you ever returned to teach here again. The residents would learn more in a single hour with you than from months of textbooks." Grace smiled gently, but did not answer immediately. Instead, she pushed the cleaning cart forward a few inches and looked down the quiet hallway, stretching into the darkness of the hospital night. "Sometimes the best teachers do not stand at the front of the room," she said softly. "Sometimes they simply appear when someone needs to learn how to listen." Grace Walker stood quietly beside the cleaning cart while the dim hallway lights cast long reflections across the polished floor outside the lecture hall. Dr. Lucas Bennett remained facing her, the weight of the night still resting heavily in his thoughts. For years, he had believed that mastery in surgery came from confidence, from decisive action, from standing at the center of the operating room with authority. Yet the woman in front of him had just shown him something far deeper. She had stood quietly at the edge of that same room, holding a cleaning cart, and still understood the patient anatomy better than the surgeon leading the procedure. Lucas glanced once more through the half-open door of the lecture hall behind her. Rows of empty seats stretched toward the large screen at the front of the room where countless young doctors had learned the foundations of medicine. "I remember one particular lecture from my residency," Lucas said slowly. "It was about unusual arterial variations near the kidney during traumatic injuries. The instructor told us the method came from your research." Grace Walker listened calmly, her expression thoughtful. Lucas continued speaking, the memory returning clearly now. "That lecture saved the patient tonight, even if I did not realize it until later." Grace rested one hand gently on the cart handle. "Knowledge travels in quiet ways," she said softly. "Sometimes it reaches people long after the moment it was first discovered." Lucas nodded. "That knowledge shaped my entire surgical career. But tonight the person who taught it was standing right beside me, and I failed to recognize her." Grace looked down the hallway again before answering. "Recognition is not always necessary. What matters is whether the lesson is learned." Lucas absorbed those words in silence. The hospital felt peaceful at this hour, the long corridors nearly empty while the night staff moved quietly through their routines. A distant elevator chimed somewhere in the building and then fell silent again. Lucas finally spoke with quiet determination. "The residents here would benefit from hearing your experience directly. Your work changed the way trauma surgeons repair vascular injuries." Grace gave a small smile that carried both gratitude and distance. "My time in that world has passed," she replied gently. Lucas shook his head slightly. "Respectfully, I do not believe that is true. Great teachers do not stop being teachers simply because they step away from the spotlight. Grace studied his expression for a moment, seeing the sincerity in his eyes. "You are kind to say that," she answered. "But the hospital has moved forward with younger voices now." Lucas glanced again toward the lecture hall. Perhaps. But wisdom does not expire the way credentials do. Grace remained silent for several seconds before responding. "Then let the lesson continue through you." Lucas looked back at her. "Me?" "Yes," she said softly. "Every surgeon eventually becomes a teacher whether they expect it or not. The residents will watch how you speak to the people around you. They will learn from your decisions inside the operating room and from the humility you show outside of it." Lucas understood the meaning behind her words immediately. The greatest lesson of the night had not been about anatomy or surgical technique. It had been about respect. Earlier, he had looked at Grace Walker and seen only a uniform and a cleaning cart. Now he saw the mentor whose knowledge had guided countless surgeons before him. Grace gently pushed the cleaning cart forward again. The wheels rolled quietly across the floor, while the faint scent of disinfectant followed behind. Lucas stepped aside to give her space to pass. As she moved past him, she paused briefly. "The patient tonight will have a strong recovery if you continue monitoring the repair carefully," she said. Lucas nodded. "I will." Grace gave one final small smile before continuing down the corridor toward the darker end of the hospital wing. Lucas remained standing near the open lecture hall, watching until the quiet figure and the cleaning cart disappeared around the corner. The hallway fell silent again, but the lesson she had given him would echo through every operating room he stepped into from that night forward. Dr. Lucas Bennett remained standing near the lecture hall long after Grace Walker disappeared into the dim corridor. The hospital had fallen into the deep quiet that only came during the final hours of the night shift. The fluorescent lights hummed softly above him, while the polished floor reflected the pale glow like still water. Lucas slowly stepped into the empty lecture hall and looked across the rows of seats, where generations of young doctors had once struggled to understand the complicated language of the human body. He remembered sitting in a chair near the back of the room during his residency years, watching recorded lectures about complex vascular reconstruction. One of those lessons had explained the exact arterial variation that nearly cost a patient his life earlier that night. At the time, Lucas had simply memorized the diagram for an exam. Tonight, he finally understood the mind behind that knowledge. The next morning, sunlight poured through the tall windows of the hospital lobby as the daytime staff arrived, and the building slowly returned to its usual rhythm of movement and conversation. Lucas walked through the lobby with a quieter expression than usual. The events of the night had settled into something permanent inside him. When he entered the surgical wing, he saw several medical residents already gathered around the conference table, reviewing trauma cases from the previous shift. They looked up when he walked in. "Dr. Bennett," one of them said, "we heard you handled a difficult vascular repair last night." Lucas placed the patient chart on the table and nodded calmly. It was a challenging case. The residents leaned forward with curiosity. What made the repair so complicated? Lucas paused for a moment before answering. "The anatomy was unusual, and I nearly made a mistake because I was too confident in my first assumption." The residents listened closely. Lucas continued, speaking with a tone that carried more reflection than pride. "In surgery, confidence is important, but humility is even more important. Always listen carefully to the people around you. Sometimes the most important observation in the room will come from the person you least expect." One of the younger residents looked puzzled. "Did someone help you during the operation?" Lucas smiled faintly. "Yes. Someone reminded me that experience does not always announce itself with titles or recognition." The conversation continued as Lucas explained the technical details of the repair, guiding the residents through the same arterial variation that Grace Walker had recognized instantly. When the discussion finished, the residents returned to their rounds while Lucas stepped back into the hallway. He glanced down the long corridor where the night shift cleaning crew usually worked. The floor had already been polished, and the faint scent of disinfectant lingered in the air. Grace Walker was not there. Later that afternoon, Lucas asked a nurse if she had seen the night cleaner who worked near the surgical wing. The nurse nodded. She finished her shift early this morning. I believe she asked to move to another floor starting tomorrow. Lucas stood quietly for a moment after hearing that. Part of him understood why. Grace Walker had never needed recognition or apology to prove who she was. Her knowledge had already shaped the lives of countless surgeons who never realized the quiet source behind their training. That evening, Lucas returned once more to the lecture hall where he had stood the night before. The room was empty again except for the fading light from the setting sun shining through the windows. He looked toward the front of the room and imagined the lessons that had once been taught there by a surgeon who had seen more than most people ever would. Lucas spoke quietly to the empty seats as if the lessons still echoed through the room. Respect every voice in the room because wisdom does not depend on a uniform. Then he turned off the lights and walked back into the hallway knowing that the most important surgery he had performed that week was not the one that saved a life in the operating room, but the one that quietly changed the way he saw the people around him.